Thank you for staying tuned. Our first conversation on the program this morning is on how we can identify learning difficulties and, of course, challenges in children. We all know it varies from one child to the other. We'll also talk about the treatment available and the symptoms that parents with such child should look out for. It's a broad topic, and we have someone who is very passionate when it comes to identifying learning difficulties in children with us in the studio this morning. We have right here with us Dotun Akonde, founder Patrick's Speech and Language Center. It's a pleasure to have you.
Thank you for having me. Yeah.
All right, I think you should just take us through what learning difficulties and disabilities are. And is it the same with every child?
Learning difficulties can come in various ways, and it's not the same for every child. So there are various types. You have the dyslexic, those that have difficulty reading. You have the dysgraphic, those that have difficulty writing. You have dyscalcular, those that have difficulty with maths and numbers. And then you have dyspraxia. Those are the ones that have challenges with motor skills. So, and we're seeing a lot more of that now, because we are seeing a deviation from the norm in terms of women fertility. More people are going to IVF, more people are using surrogates to have children. So we are seeing a lot more of those different learning difficulties. And it ranges, it's not the same for every child. Even with dyslexia, it's not the same for every child. Some children will learn with stencils. So stencils are things that you can put on a piece of paper to identify each word as that child goes in. Some children learn with colors. So if you color code some of the words, the child will be able to read, better, depending on the challenges that child faces.
Yeah. I've also noticed that some children are also hyperactive.
Yes.
Is that also a disorder?
Yes. And then when you talk about dyspraxia, you find problems with sensory coordination, you find problems with hyperactivity, problems with sensory overload. So when you see the children and you find some of them covering their ears to loud noises, those are some of the signs that tells you that something is not quite right. And that is some of the red flags that we see and we begin to identify at an early age. There's also something we call retained reflexes. So when children are born, when they pass through the birth canal, some of those reflexes are helped. So when we were growing up, in the days of our grandmothers, you see that when the children are being born and then they are bathing the children, they hold the children and they shake them. So that is to reduce the reflexes that is retained over time. I know in these days now we are looking at, okay, how we can, that can cause choking, that can cause a lot of things. But if you go to the traditional birth places where this is done properly, is to remove those retained reflexes. Those retained reflexes is what we call flight or fright. When you see something, so some children are very frightful. They can't even climb staircases. Those are the children that we say we have dyspraxia. They have coordination issues. They have sensory issues. They process information differently. So ordinarily, if I speak to you now, you take an action. For some children, the process is delayed. So between the time the information passes from the ear to the brain to action, for some children, it takes a whole day.
Why is that so? Because
of the learning difficulties, because of the difficulties they have in sensory issues.
So it takes time for them to process the message.
Yes. So for such children, you don't give lengthy information. You don't say, take this cup, put it on the table, and pour water in it. So you take it one after another to help that child to be able to process the information. You have to be patient. You have to understand the needs. That is why it is important for us to do an assessment of what is going on. And it's not the same for every child, even those that are on the same level. Yes.
Okay, there was an instance that one of my colleagues over there cited yesterday, Joy, about our boy writing 60 the other way around.
Yes.
Joy, I hope I'm correct.
Yes, he writes 60 the other way around, or sometimes the M is dancing.
Yes, that's what we call dysgraphia. And then sometimes the visual perception, the way he sees it, is not the way it is. So it can be corrected. You can help the child over time. But what we call is also a form of learning difficulty. So if I see this cup here now, the child might be seeing the cup in another direction. So it's visual perception. The perception might be wrong. But if you are patient enough to walk through with that child and give that child the necessary accommodations that he needs to be able to focus and do it right, they usually get it right.
Okay, that visual, does it affect the audio as well?
Yes, there's auditory complexity, there's visual complexity, auditory, and there are some individuals that we call the left ear brain and the right ear brain. So information passes through, I can't say that categorically as it should, because that is another area of specialization. But those that are, I think those that are left ear brain, the information goes through passes through the ear and goes to the brain before it goes into action. It takes a longer period. So I'm not sure if it's the left or the right side of it, but that is also a challenge. And also, some people can filter sounds. Some of the children can filter. So as I'm speaking, the air conditioning is on, the door is creaking, he's taking everything in, and that is confusing his ability to attend to whatever is in front of him. So he's worried about hearing everything else and not being able to filter it out. For us, we can filter it out. I mean, I'm sitting here now, probably the AC is on. I'm not worried about that because I'm focused on what I'm saying and I'm thinking about it and I'm saying it. First,
But such child will be worried.
Will be worried. So the attention is not there. So you have to make sure that the environment in which that child is learning is an environment that is very calm and an environment that is not noisy. That is why sometimes when they go into the shopping area and they see a lot of people, they cannot perceive, the number of people they see becomes confusion. And then the child just starts to melt down at that point in time. And sometimes the noise is too much. Then you get the child having a complete meltdown and the parents are frenzied. Everybody is wondering what's wrong with this child. Does this child have mental health issues? Does this have... But it's all sensory. And it could be underload or overload. So that is why it is important we do an assessment.
Okay. I see passion in your eyes each time you talk about these particular learning difficulties. Take us through your own journey and how you were able to navigate this path. And where's the child today?
Oh, okay. My journey is that of a mother that was just a banker and eventually, had a child on the spectrum. And it was difficult because he was very, like my sister said over there, his writing till he left primary 6, his writing was so big, you could feel just a sentence could feel a whole exercise book. So we were wondering, what is the matter with this child? Of course, one of the signs that you sometimes see with learning difficulties is that the child is not speaking. He didn't talk till he was 5. He had words when he was 18 months, and then when he got to the age of 2, he lost everything, and then he regained it back at 5. We walked through it through primary school. Primary school was very difficult because he had to learn a lot of the things that were not mathematical, and his brain is quite mathematical. He would look at numbers, and it would come to him without, stress. But to read was such a huge challenge for him. And it's not the reading, it's the comprehension of the reading. That was the main difficulty. So he will struggle with things like literature, things like history, but he will excel in things like language. Language has a pattern. Apparently, I didn't know that. He was the one that told me when he grew up that, Mommy, language has a pattern. So he will excel in things like mathematics, things like ICT, things like science. That doesn't change. Anything that doesn't change, he would excel. So he struggled through primary school, went into secondary school, struggled between year 7 to year 9. But when he got to choose his subject, physics, chemistry doesn't change. ICT doesn't change. French doesn't change. His language, it doesn't change. And he did a little bit of music. Music, too, doesn't change. So he excelled. He had A stars in all those things. He struggled with English. I think he had a C in English. And at the end of the day, when he was about to go into university, we asked him what he wanted to study. He said mathematics.
Oh, wow.
So he did mathematics. He made a first class in mathematics. When he finished, we asked him, what do you want to do? He said, I want to do a PhD. Did a PhD in mathematics. And now he's a graduate, a PhD graduate of mathematics. So what does that tell you? Wow. Each child has a strength. If we focus on that strength that child carries, even with the difficulties, you would see a pattern. They have a pattern. And running the school for 19 years now, I can tell you that there's a pattern. No matter the age, even let's say that the parents missed early intervention, the parents didn't know early, or the parents were in denial for a long time, the child became 10. And then we need to start intervention at the age of 10. What can this child do on his own without help? That's where we start from. And then we now take it on. All the other things that we need to teach, we start from that place of strength and then teach the things that he needs to learn. They learn better because you have already put them in a place of comfort where they know what they can do.
In themselves.
And then you now begin to add tasks. And you add it gently and you allow them to assimilate it. And the more they are able to assimilate it, and the more the environment is rich and able to embrace some of these challenges without judgment. We are very judgmental.
Okay, from your narration this morning, you made it sound so simple. Like your journey was so simple and easy.
Oh, it's not simple. It's not simple. The story is short. I have a short time to say it, but it's not a simple story at all. It was a real struggle. And not only struggle for me as a mother, struggle for the child as well. Being able to cope in classroom, being able to manage side remarks for the child himself, being able to overcome bullying. It's a lot of work. So when he was having challenges with social issues, I mean, in the school, I mean, my son would wear his trousers skewed, and he wouldn't make any difference. He would just be going, and everybody would be laughing at him, and he'll be wondering, why are they laughing? You know? So he'll be wondering because of the ability to comprehend. It still comes down to. So all those languages, you must teach it. So I taught him, I said, look, if so person does so thing, just keep your calm. If it's something you cannot manage, talk to your class teacher. But I'm not going to come to your school and be fighting on your behalf. No, that's not my responsibility. It's to teach you the coping skills, because am I going to go with him to workplace?
There forever.
I will not go with him to the workplace. And a parent's fear all the time when we have children with difficulties.
They keep them at home.
The stigma. The stigma. What will the world say? I tell parents, let the world say what they want to say. Let your focus be on
the child.
What that child can do when you are not around. We don't know how long we are going to be around for. And you want that child to be able to be successful without you. So that is the path I always encourage them to take. If they are laughing, come, bring the person close to you. Teach the person, oh, you know, my child is behaving this way because he has problems with understanding language. He has problems with figures. He has problems with social issues. Because sometimes, between the time the information gets into the child's ear, to the brain, to action, I told you 24 hours. For some children, it's 1 week. And it's after that 1 week, they will just be sitting down and then start laughing. And everybody will be wondering, what is going on? You know, it could be a cartoon that he has watched maybe 3 days back that just finished processing. And then the child starts crying for no reason. You know, and many of these things is internal. If you are not...
And you have to process it.
You have to process it. If you are not patient, if you are not... if you don't focus on what you want that child to be able to achieve, you will not get the best of it.
So as parents now, how observant or vigilant should we be so that we can detect those signs early?
Very observant. For instance, a child that is at 1-year-old, you are calling the child appears deaf. That's one of the signs for processing issues. Between the time you call the child's name and the brain goes to, the information goes to the brain and the child's action, it takes time. So sometimes they appear deaf. So what you can do when you have such a child is, if the child loves a particular cartoon, I mean, just play it at the lowest volume and see if that child will, when it comes up, if that child will run towards that noise. That will tell you that that child has processing issues. 2, if a child is in an environment and is struggling with lights and is struggling with sound, that is a red flag. If a
Light
child,
and sound.
Yes. If the light is too much and you find the child closing his eyes every time to the lights, visual perception will be a challenge for that child. If you find the child covering his ears to loud noises or sudden noises, or the child always being afraid, cannot climb a staircase, looks at the staircase and becomes weary, or the child is constantly bumping into other children and does not understand boundaries, or the child is hyperactive, cannot sit still. We have so many of them in the classroom today, and that is because of those motor reflexes that we spoke about, those retained reflexes. If you can do simple exercises, can help reduce that retained reflexes.
When people are restless, does that imply they are hyperactive?
Some of them are restless. Some of them, so
I am restless.
You find maybe your motor reflex is wrong. And it's so simple for us to check it out. You go on all fours, you run your fingers at the back of the child. If the child wriggles or have a feeling of wanting to pee, then you know that the child has retained those motor reflexes. And there are exercises you can do to help that child out of it. It's quite simple, but it's also complex because you have to go, you have to learn it, you have to do the training, you have to learn how to identify the motor reflexes, you have to learn what to do to make sure that those motor reflexes are completely desensitized and the child can sit still, and you can get the child seated and ready for learning. If gross motor is poor, that means if the child is not well coordinated, if the child is bumping into other children, if the child cannot kick, catch, throw, that child will have difficulty writing.
So when we see those symptoms, what should be our first step to take?
The first step is to do an assessment. You can do cognitive testing. You can do intellectual testing by a psychologist. A psychologist can do that easily. And you can use your observations. Very, very important. We don't take it seriously, but the observations are the ones that tells us the key issues. Because the psychologist will be with your child for 2 hours, but the mother will be with the child the whole day. So she's the one that will tell you, you have to be very vigilant. That is why pregnancy history is very important. Birth history is very, very important. That tells you what went on and why some of the things that this child is facing is causing this. So you can have a clear picture of the intervention you want to put in place.
Okay, some of these tests that you just mentioned now, are they cheap? Are they affordable?
I can't
And the treatment as well.
I can't say that. You see, when we talk about treatment and I can't say about the assessment. The assessments, maybe some people, it's not cheap actually. They would have to pay quite a bit. Maybe about, I think it spans between 250 or 350,000, which is a lot of money for the common man. So I tell parents that can't afford services. I said, look, in the days of our grandmother, there is the observation of observing each child. Why were they able to do that? Our grandmothers were not as busy as we are now. So looking at each child, they could identify this boy, this is how you are going to turn out. This boy, this is how you are going to turn out. So if you are observant as a parent, list down the things that you know that child has challenges in. Then look at the behavioral pattern of that child. Is that child an auditory learner? Is he a kinesthetic learner? Meaning, does he learn by movement? Some children cannot sit. They learn by movement. You won't believe I was in a classroom of adults living with autism, and everybody was seated in class. And it was only the one that was not seated that could answer the question the teacher posed. Because it was a special needs classroom, the teacher didn't mind them pacing. He was, accommodating anyone that would. But find out what that child can do and how he learns. Does he learn by hearing? Does he learn by writing? Some children learn by writing. Some of us, if we don't copy from the board, we will not be able to answer some of the questions. Some of us, if we don't attend lectures, we will, no matter how much we read, we will not be able to pass that class. So you have to. That's me. So you have to know.
You are speaking to some people here.
Exactly. So you have to know the pattern of that child. Once you are a parent, you know the pattern. Whoever is going to intervene on the behalf of your child, be involved, because you are the one that will tell that pattern. Without that story, that person may never be able to reach that child. So we must not disregard the power of parents, the power of being the mother of that child. Don't leave it to the practitioner.
What about the
father? The power of the parents. Remember I said the power of the parents.
Mother and father.
Mother and father.
I want you to expatiate on the issue. When you raised something, you said birth history.
Yes, sir.
I've heard all sorts about children born with jaundice.
Yes.
That if it wasn't well treated, it causes, some of this learning abilities.
Yes.
So I'd want you to just expand.
Okay, so jaundice usually has to do with a lot of the motor skills.
Okay.
So many times, many of these children come out with jaundice. But the birth history also has to do with how the child was born. Was the child born through natural birth or cesarean section? Many of the children born with cesarean section, their motor reflexes are retained because they did not, that butterfly, and the cocoon issue where you break it and then the butterfly dies. Okay. So that motor reflex is how do I put it? Is helped during the birth when the child is coming out through the birth canal. But when the child comes out frightened, is retaining some of those reflexes, and they can, you can help it with exercises. Simple exercises can help, desensitize the reflexes of that child. So jaundice is a big issue that we must look at, and we must also talk about it, because many children with jaundice end up with a lot of issues that we cannot talk about. We can't exhaust it. And we need to do a clear research on that, because many of the children that come to us, they come with jaundice at first.
So let's talk about treatment now and the availability of professional teachers who are patient enough to manage these children.
Well, we are very big now on inclusion and making sure that children are included in the mainstream school. So it's the responsibility of the schools. When the schools are beginning to take this to our children and they are not equipping the teachers, it's a challenge. But what we've done is that we've started like a training session where we train teachers and specialists and parents. And particularly, we are very particular about parents because they are the primary caregivers. True. All these other specialists are secondary caregivers because they only spend a couple of hours with them. But if the parents are trained and understand what certain things that they need to do in the home environment means to supporting that child, we usually get a very, very, very good result. So the specialists are few. They are still very few and far between. But we have opened up a training session. We've partnered with other specialists, speech and language therapists, occupational therapists, physical therapists, to bring together a training program to support these individuals. And we do it, I think, 3 times in a year.
Okay, I'm just curious to ask this particular question. The lifestyle of a mother while carrying the baby, does it affect the learning ability of the child in any way?
The lifestyle does, because if you have a woman that takes a lot of alcohol, some of our children come out with learning difficulties. The lifestyle matters, and what the mother eats matters. So we always try to tell them to stay clean. Staying clean means that they stay away from alcohol, they stay away from GMO foods, they stay away from processed food, they eat our natural food. Anything that grows on a tree or in the ground, we encourage it. So that at least you've done your part as a parent. Because when we started with autism in 2000, and I think we started in 2006, it was 1 in 150. Now it's 1 in 34. Telling us that there's a rise. And we know there is nothing anybody can tell me. I would be controversial on this. Nutrition plays a very high profile on those parents, on those children. Some of the children change their nutrition in 24 hours. You will see results.
I want to talk about an observation I've made, over a few months. For my neighbor's child, the child is always howling. I think she's a girl. And I've, tried talking to the parents that, look, can you take this girl to see a specialist, Well, why is she saying, no, she'll get over it. So there was a day I was by the door talking to the mom, and she just kept on running out, and the mother was pulling her back, and she'll run to it's just a particular sport. She'll run to that sport, and mommy will pull her back. You want to, and I said, this girl needs to see someone. He said, no, she'll be fine.
In denial.
Yes, living in denial.
We still have that. We still have
it?
Oh, we still have a lot
Yes,
of people
like
in
her.
denial. Yeah. Oh, we still have a lot of people that the children are still at home. We still have that. And what I would advise, Ma, is that if the parent is not willing to take her out, let the parents get trained. Let her get the training that is needed for her to understand. Because behavior, I'm also going to be controversial about behavior management. Behavior management, many times we want to change the behavior. I would rather observe the behavior. The behavior tells me a lot of things because a lot of our children are non-verbal. They don't use words. So we have to be guessing. It's the behavior that tells me, oh, this is why that girl is running to that particular spot.
Because maybe I've been observing. I just see she runs to that spot and she stops there, and her mom will pull her back. She goes back to that same spot.
Yes, there's
keeps
something
going
she's
there.
trying to say, and we
By
must,
running to that spot.
Yes, there's something she's trying to tell us. So when we see that pattern is very important. When we see a pattern, we must follow it through and see. Yes,
Pattern.
See,
You said
yes.
it. You said
Okay,
it.
so how do we create a support system for those who are going through these difficulties and, of course, give them the confidence to overcome the stigma in our society?
I think Lasoda does good work when it comes to support system. They have a very strong group of parents. Whatever your cadre, I mean, if you are on the lower cadre or in the middle cadre or in the higher cadre, Lasoda caters for all. Because they open us up to programs that will enlighten the parents on how to manage these children. Now, is that particular parent willing?
This is another
Support system has grown tremendously over the years. I mean, when we first started, when we first started, it was few and far between. But now we have a very strong community of parents, even to the point that some of them are coming together to form a cooperative, doing farming, doing small businesses together to support their children. So I think now we are much more aware of what is going on, and parents have enough support. But if they have any need, they can go to LASODA, Lagos State Office of Disability in Alausa. They will direct them to the places where they need to go. If they need to come to us, they will tell us. They will tell them. If they need to go to other places, they will tell them.
And you help them overcome the stigma?
We challenge them. We give them assignments. If you are taking the bus and somebody is saying that your child should not sit close, tell them what is wrong with the child. Educate that individual. If tomorrow that individual is seated next to another child with the same behavior, he will be able to recognize
But how many
it.
people will be that confident?
That's why we need the training. That's why we need the support. That's why we need the hand-holding. It goes a long way. When you are in a particular group and you are within your setting, you are more confident to be able to speak about it. So with that confidence put in the parents, eventually they become bold enough to be able to do it. They become emboldened.
Okay, for those parents who are watching us right now and they have given up, what will be your message to them? Because your child is a living example of somebody who had to go through that difficulty, and today is a PhD holder.
Do you understand?
Yeah.
What are they giving up on?
That difficulty for parents is what I would like to tell parents, especially those that have missed early intervention and those that have given up, those that have said, my child did not start early. This is what I want to do. Don't give up. Morning is any time you wake up.
All right. I'm aware we have to take a very quick break on the program at this moment. We'll take a short break. When we come back, we'll be wrapping up from this end on the conversation. We still have here with us Dotun Akode, founder Patrick's Speech and Languages Center. And of course, we're still speaking on how we can identify learning difficulties in children. And while we were on break, a colleague of mine raised something very, very important. How we always think, okay, when a particular child is this way, it is always a spiritual attack.
Yeah.
So what are we doing in terms of awareness to correct all these anomalies?
You know, we are very superstitious in this part of the world. And the spirituality we attach to some of these things is not only in the area of special needs, it's all in all areas. But particularly when the child now becomes a child with special needs, the hope of the parents is already dead. Then they start to think, what did I do? Who did I offend? Where did I go? Who touched my tummy during the time I was pregnant?
Is it my mother-in-law?
Oh, my mother-in-law. I ate her food. You know, so the perception is so real. And honestly, if you are in that space at that time, there is no way it will not occur to you. But you have to rise above it. And in rising above it is to look at, okay, we always tell them when they say that it's spiritual attack. Okay, let's assume it's spiritual attack. Where do we go from here?
You pray.
Let's go and pray.
Where do we go from here? You are praying. Okay, now that you are praying, how many years have you been praying? What has happened? Has anything changed? No. Then do the works. Whatever it is, you must work at it. You must put your best foot forward. Don't let that child get to the age of 30. I mean, we were talking about what happens if the parents have given up. There was a woman that gave up. She gave up. She was just looking at her child at home, 35 years old. Looking at him, and she just saw one of our flyers and she said, let me even go to this place. I don't have money, but let me go to that place. I know that they are in GRA. They are going to be very expensive. Let me go there and let me even go and see what happened. And she came and we said to her, we've never taken a 35-year-old before. We don't know what a 35-year-old will be able to do. We don't know the outcome. But we can help you. We will be able to help you. She said, I don't have money. We said, don't worry. We will take you on. It's also an opportunity for us, for this 35-year-old to teach us some of the things that we need to learn from a 35-year-old. And that 35-year-old came. A 35-year-old that could not sit still. In 6 months, that boy was, that young man, not only a boy, was sitting still in church. They would go to church and he would sit in church. So the pastor called her and asked her, what's going on? What are you doing with this child? I said, it's this place that I took the child to. Learning from that. Today he's 42. He can do, when we are arranging things in the school, he would have, he's still limited in speech. He doesn't speak, except he wants to eat. He will tell you, Mofe Jel. And if somebody younger than him comes to him and tells him, Shew, he won't answer. If they call him Uncle Shew, he will answer.
Wow.
So it tells you that, look, our perception, just like Auntie said the other time, the way we perceive the children matter a lot. If we say this child is going to be seated there for 25, 24 years, so that child will be seated there. Our perception of hope, of ability, must always come first. Okay, if it's a spiritual attack, what are you doing to ward off that spiritual attack? What are you doing? What steps are you taking
Practical
as a mother?
steps.
Practical, not going and going. Sometimes prayer and fasting works. We won't say it will work, but sometimes
it needs to be work put in.
To be real to yourself.
You need to add something to it. Okay. And as a parent, there's something I also want them to know. There's this sixth sense. There's something that tells you take this step. Don't discount that voice that tells you take the step. Take that step and see where that child is going to go.
Okay, aside from coming on a show like this, the awareness, is it out there?
We are trying. In fact, in recent times, more centers have opened up. I mean, when we first started, there was absolutely nothing. There was hiding. But once parents start coming out to speak, and not only to speak, to showcase some of the things that the children can do. Today, we have those that are not using words. They cannot even sit in a gathering like this. But put a piece of paper, put coloring, put pencil, put painting, they will give you a masterpiece. Telling you that, I mean, there's something in that individual. There's something in that child. Probably if you continue to mentor that child and support that child in that place of interest, all the other areas that you feel you will not be able to achieve, the child will eventually achieve it. It has happened before. It has happened many times. There was a young boy they brought to us at 3. No speech, nothing. He speaks 3 languages now.
Wow.
He speaks German, he speaks French, he speaks English. You know, so in those, don't discount that individual. No, there's Nimi. The mother too is very vocal. She goes out there, takes her daughter everywhere. Her speech is not audible, but she speaks. And she's in class, she's in the classroom. She passes exams. She might not be able to write physically. She can tell you the answer to the questions when you ask her. So all those accommodations need to be put in place to support these individuals. And that's where the government comes in. We need policies that can give these children an opportunity to thrive. When you put them in places of strength and the places of self-worth, when you dignify them themselves, they begin to show you another side. There's a young man that was with us at the center. He will tell you the day he started Patrick's. He will tell you, if he sees somebody he has seen before, he will tell you where he saw you and your name. But he still struggles with other things. He struggles with academics, he struggles with learning. And one day we decided that this boy is at the center and we don't think that he would benefit from therapy anymore. Let's employ him as a staff. You know, so we said, oh, okay, Emeka, you are now a staff at Patrick's. So one day he walked into my office and asked me, do staff wear uniform? Because our students wear uniform.
So you can think that far.
I mean, I was in total shock. I said, Emeka, you are very right.
Yeah.
Staff do not wear. So tomorrow I can come in my shirt and my tie. I said, yes. And then eventually the mother opened up a school. When the mother opened up the school, she will tell the mother, this is not how they do it in Patrick's. In Patrick's, they arrange the tables like this. There is somebody at the gate. You know, the mother was so amazed at what he could.
So when we see those strong signs or ability of those child or children, what should we do?
We should
to further magnify or amplify it.
We should harness it. We should sharpen it. We should make them if the child decides to be the one that serves you tea in this place, let the child be the best at serving that tea. Let him know the timing. Let him know. They work very well with structure. You put structure in place. You tell them that at this time, this is what it's supposed to be. Their brain already takes it in, locks it in, and works at it. And the confidence that you would see in that individual, because he is appreciated as a person, it's out of this world.
Okay, when managing these children, do you also manage the psychology of their parents?
Oh, yes.
Because that is key.
Oh, yes. You manage the Okay, I'll give you another example. One of my young ladies at the mother wants academics. The mother wants academics. But this young lady loves to make hair. She braids hair. So we told the mother we are going to 3 days in the salon, 2 days at Patrick's.
Yes.
3 days in the salon, 2 days at Patrick's. And one day I went to the salon. She was there. And she looked at me, a young lady that ordinarily would not say anything. She said, what are you doing here? I mean, so telling you that in their quietness of not being verbal does not mean they are stupid. All we need to do is, and in that salon, she has thrived, she's more confident, she's trying new things, she's excited. So we are telling the mother, reduce the number of times she comes to Patrick's and increase the time she spends in the salon. So that way, this young lady, when she braids hair for you, oh my goodness, you won't even believe that it's somebody that has learning difficulty that could do that effectively.
Okay.
So we had to play with the psyche of the mother as well. So we told her, don't pay school fees at Patrick's anymore. Let her just come, and then so that way we also reduce the anxiety of, oh, I'm going to be paying fees. I'm still going to be paying fees, and I want this. Don't pay. Let's see where this young lady will get to, and then we can give the right, support all the way.
All right. For children who whose parents cannot afford special schools like this. You have children with learning disabilities in normal schools. Now, my focus is the teachers. Do you think that they are fully equipped, to handle this kind of children? There was a video trending over the weekend where a teacher was slapping a 3-year-old because he could not write 6, So do you think that teachers in these schools are fully equipped to be able to identify when a child has learning disabilities?
Let me quickly say something about some schools. Some schools, when you tell them to train their teachers, they will say no.
Yeah.
That the teachers will leave.
Yeah.
And then you ask them, what happens to your school?
Yeah.
They don't train.
I mean, like she asked, what is the vision of that school? What is the plan? Who runs the school? What plans do they have for children with special needs in their midst? Some of these schools, they take double school fees for children with special needs. If we must say the truth, they take double school fees and they don't train those teachers. We encourage for the schools that have the wherewithal to be able to support these families, train your teachers. Okay, you can say training is expensive. Train one teacher and let that teacher train the trainer.
Come and train the child.
Let that teacher train her colleagues. That's how we do at Patrick's. When we started Patrick's, nobody knew what autism was. And I did not want to take teachers. What I found was that when we take on teachers that are already in the teaching profession, they were very difficult to train. They were set in their ways. You could not twist or turn them. So what I did, I went to the special schools. I took on the new teachers. I started to train. I would go for the training, come back, put everybody together, train the teachers. Then we now allow the children to train us sometimes. Because it's from observation of those children that we learn a thing or two. So we come together with one, as a team, one head, and then start to look for ways in which we can sharpen. And mind you, all the training abroad, many of them don't work in our setting. You have to come back. You have to culturalize some of this training. We put local content into it and fine-tune it to suit our own environment. And Nigerian environment, honestly, this country is one of the best countries in the world. It's a beautiful environment because our culture speaks volumes in the lives of our children. Our culture is such a rich culture that we encourage a lot of our children to do. We don't take no for an answer. We don't take no. We always say, oh, you can do it. Oh, you see, Emeka did it well. Oh, you are going to do it. You too can do it.
So talking about, you've talked a lot about parents' support, and we're still talking about family dynamics. Let's look at the role of siblings now. What role do siblings play, or how much support can they give their fellow sibling with learning disability?
Siblings is two ways. It depends on how the parents present the child with special needs. Then the siblings will embrace. Some parents present that child with special needs as
inferior.
Some of them even, some inferior, but some of them
better,
as the life of the home. So they neglect every other child and focus on, and then the siblings become resentful. And some of them hand this child over to the sibling. This is your brother. You are not going anywhere. If you go this way, it's still your brother. If you go this way, it's still your brother. So it depends on how the parents present the child with special needs to the family. And it is better for you to hand that sibling over to the sibling without special needs, because what that does is that it builds empathy in that sibling. And that sibling is able to see the world and be able to understand that we are not all the same in this life. There are some things that my brother can do well that I cannot do as well. There are some things that I can do well that my brother cannot. So they are more accommodating of people, and they are more empathetic towards the needs of others than those without children with special needs. I have a sibling that had polio when she was very young. Our firstborn had polio, and my father did not discriminate. He took everybody. In fact, I always say, when I'm broke, it's my sister that I go to every time to raise me, because She could do everything on her own. She could drive. She could. My father gave her the best of education, and today she's somebody that is without her counsel, many of us would have gone in a different way. She's very patient and she's understanding of others, and she's very well-to-do in terms of resources. She's a chartered accountant, and she works in the oil company, and she's done very well for herself. So it depends on how you present that child to the sibling, and that makes a huge difference. Now, there's a story of a young lady that the two siblings traveled abroad. I think she's a middle child. She had an older and a younger child, and then she's one on the spectrum. And the mother shielded her from everybody, shielded her from the community, shielded her so much that when it got to a certain stage, the mother felt that she was old enough to be married, found her somebody, married her off, and the husband and the lady, they were living in the house with her. Then COVID struck.
Wow.
Then the woman died. So, and the two siblings were abroad. So they rushed down because they were wondering, how can we manage this? And so they brought the young lady to us and said, this is what we are facing. So we asked her, and she had a baby. What can you do? She said the only thing she can cook is Indomie, because the mother got her a nanny and everything. And, you know, in the end, we had to find that young lady a job for her to be able to do. Because she was shielded for a very long time, she did not, you know, understand social settings. So we kept her in a place and started to introduce her to work program. That was how we started with it. So we started getting her to go to work 2 hours in a day. We increased it to 3 hours. We increased it to 3 days a week. You know, and eventually she was able to cope. You know, so it is never late. Intervention is never late. It just means that we need to embrace it early. The earlier we start, the better the turnout.
All right. We must thank you very much, Dr. Akode, founder, Patrick Speech and Language Center, for coming to educate us this morning on how we can identify learning disabilities in children. We thank you very much for your time.
Thank you for having me.
You're welcome. All right, we'll take another quick break on the program. We'll be right back.